I suppose the short-term plan is the 25 million that was announced in the budget to address the number of delayed discharges. There are roughly 800 people across our acute hospitals who don't need to be there. They're mostly elderly patients. They should be at home or in a nursing home, but the supports aren't there for them to do that. So the 25 million will really help and will improve the situation for a time, but it's not a long-term solution. And I can understand where the nurse union is coming from in calling for this to be described as a national emergency. Actually, Mary Harney did that, I think, about 12 or 13 years ago. And what we actually have in emergency departments is a chronic problem. It waxes and wanes. Sometimes it gets worse, sometimes it gets better. But if we really want to resolve it, what we're going to need is a long-term plan that deals with everything from better use of existing beds, better patient flow. There's huge variation in the quality of management and patient flow across hospitals, and then also solutions such as additional long-term care beds for older people. But all that's expensive and is going to take time to put in place, and it's not just about time and money as well. We have a very bad history in our health service in Ireland of when you do provide more capacity, you actually find efficiency falling, and we need to make sure that doesn't happen either.
How are you going to do that?
Well, one of the things we're going to do is we're going to reconvene the emergency department forum that was there up until about 3 years ago. I'm going to reconvene that, and that's an opportunity to get all the different partners and all the different people interested in health service together. It's planned to have the first meeting of that in a number of years. It's planned to happen next week, and I'd hope to bring a plan to government probably sometime in the new year as to how we can address this as a long-term problem. It is going on far too long. For as long as I can remember, we've had overcrowding in our emergency departments. We've had patients on trolleys. It just gets better and worse from time to time. I think we need to get on top of it once and for all. But I'm realistic about it. If you take, for example, my constituency, which is a North Dublin constituency, my local hospital, Connolly, has overcrowding from time to time. There are now 3 nursing homes planned for that constituency. But even if we start building them today, it'll be 18 months before they're completed.
Okay.